Ever wondered why monitoring your blood pressure is vital during pulmonary rehabilitation? Well, let's unravel this mystery together. Monitoring blood pressure serves three main purposes. First, it ensures your safety. While you engage in exercises and activities, keeping an eye on your blood pressure helps to safeguard against potential cardiovascular risks. Second, it helps in assessing your cardiovascular health. Many lung conditions are closely linked with heart health. By keeping tabs on your blood pressure, we can better evaluate and manage any heart-related concerns. Lastly, it aids in customizing your rehabilitation program. The data we gather from these measurements enables us to craft a treatment plan and exercise regimen that's personalized to your needs. So you see, blood pressure monitoring isn't just a routine procedure. It's a vital tool in your journey to better lung health. Understanding these factors will help you realize why blood pressure monitoring is a key component in your pulmonary rehabilitation. Now we move on to the practical part. Using a blood pressure cuff might seem complex, but we'll break it down into simple, easy-to-follow steps. Firstly, choosing the right cuff size is crucial. You need a cuff that fits comfortably around your upper arm. Remember, an ill-fitting cuff can skew the readings, so it's worth taking the time to find the right size. Next, we have patient preparation. This involves finding a comfortable spot to sit with your feet flat on the floor. It's important to rest for at least 5 minutes before we begin, as this helps to ensure a more accurate reading. Once you're comfortable, it's time for proper cuff placement. We'll position the cuff on your upper arm, making sure the lower edge is about an inch above your elbow crease. The positioning is key here, as it directly impacts the reading. Next up, we have correct alignment. The cuff should align with your heart, and we use anatomical landmarks to find the correct placement. This might sound a bit technical, but it's simpler than it seems. Then, we'll inflate the cuff. It should feel snug, but not overly tight. We'll listen for your radial pulse to disappear, which signals that the cuff is inflated enough. With the cuff in place, it's time for the slow release. We'll let the air out slowly, noting the point where we hear the first heartbeat, known as the systolic pressure, and when the sound disappears, which is the diastolic pressure. Then we'll record the readings. Both the systolic and diastolic pressures are important, so we'll write both of them down. If needed, we can repeat the process to ensure precision. Finally, we have the timing of measurements. Depending on your program, blood pressure may be measured before, during, or after your exercise sessions. This allows us to monitor your blood pressure changes in response to exercise. With these steps, you can confidently use a blood pressure cuff and ensure accurate readings. After mastering the use of a blood pressure cuff, it's time to understand your readings and their implications. When we talk about blood pressure, we usually refer to it as a ratio. The top number, or systolic pressure, indicates the force your heart exerts when it beats. The bottom number, or diastolic pressure, represents the force when your heart is at rest between beats. A healthy blood pressure reading generally falls below 120/80. Consistently higher readings may indicate elevated blood pressure or hypertension, which can be managed with your healthcare provider's guidance. Now, why is understanding your blood pressure readings important? Firstly, it ensures your safety during your pulmonary rehabilitation. It also helps us personalize your program, as it gives us insights into your heart's health. And lastly, it allows us to track your progress over time. With a clear understanding of your blood pressure readings and their significance, you are now empowered to take control of your pulmonary rehabilitation journey.